If amlodipine or metoprolol is in your pill organizer right now, there are 5 specific things that can interfere with what that medication is trying to do inside your body. And at least one of them is something you have probably done recently without giving it a second thought. Not because anyone is hiding the information, because most prescription conversations are short. They cover the name of the medicine, the dose, what it is for, maybe one common side effect, and then the appointment moves on. What often does not get covered is what happens when amlodipine meets grapefruit. When a missed dose turns into a doubled dose, when a cold remedy brings a decongestant into the picture, when joint pain introduces ibuprofen or naproxen, or when a person quietly decides at home to stop a medication because they feel tired, swollen, dizzy, or simply better than they used to feel. Each of these sounds ordinary. None of them sound dramatic. That is exactly why they matter. Amlodipine and metoprolol are both used every day to help control blood pressure and reduce cardiovascular strain, but they do it in very different ways. Amlodipine is a calcium channel blocker. It relaxes and widens blood vessels. Metoprolol is a beta blocker. It slows the heart and reduces the effect of stress hormones, like adrenaline on the cardiovascular system. Different mechanisms, same practical problem. Very ordinary day-to-day decisions can change how these medications behave. My name is Dr. Clara Hoffman. Before we continue, do not stop, reduce, increase, or change your medication based on this video alone. Everything I describe here is information to discuss with your own prescribing clinician or pharmacist. It is not a substitute for individualized medical advice. I want to tell you about a patient I will call Martin. He was 71, recently retired, very organized, the kind of person who kept his tablets lined up by day of the week and believed that because he was careful, medication mistakes happened to other people, not to him. Over the course of about 9 days, 3 of the 5 things I am about to describe happened in his routine. None of them felt dangerous. Together, they produced dizziness, unstable blood pressure readings, and a weekend urgent care visit that was entirely preventable. Stay with me through all 5 because the 5th one is the one that quietly connects the first 4. Once you understand the 5th, the others stop looking like harmless little decisions and start looking like what they really are. Common ways good treatment gets undermined at home. Thing 1. Grapefruit and grapefruit juice. This one is primarily about amlodipine. Official patient guidance repeatedly warns against grapefruit with amlodipine because grapefruit can interfere with the way the body handles certain medications and make side effects more likely. When that happens, the medication level can become less predictable, and the result may be stronger dizziness, flushing, headaches, or swelling than the prescribed dose was intended to produce. Think of it this way. A medication dose is chosen with the expectation that your body will process it in a certain range. Grapefruit changes that equation. Suddenly, the same tablet may not behave like the same tablet. This matters because many people do not connect a breakfast drink with a blood pressure problem. They connect the problem to age, heat, dehydration, or the medicine just not suiting me. But sometimes the issue is not the medicine alone. It is the combination. Martin had started having grapefruit several mornings a week because he thought he was making a heart-healthy choice. He did not mention it because fruit does not feel like part of a medication history. To him, it was breakfast. To the medication, it was an interaction. What to do instead? If you are taking amlodipine, avoid grapefruit and grapefruit juice unless your own clinician specifically tells you otherwise. If you have been having it regularly, mention it at your next pharmacy or doctor review. Thing 2, trying to catch up by doubling a missed dose. This is one of the most common medication decisions people make quietly, and it is usually made with good intentions. A person misses a tablet, realizes later, and thinks, I will just take 2 next time so I do not fall behind. Do not do that with amlodipine or metoprolol unless your own doctor has given you a very specific instruction to do so. Amlodipine is long-acting. Metoprolol affects both blood pressure and heart rate. Doubling up can push the effect further than intended. The result can be dizziness, unusual fatigue, lightheadedness, a pulse that feels slower than usual, or a blood pressure reading that suddenly looks lower than expected. In some people, especially older adults, that is enough to turn a normal walk to the bathroom or front door into a fall risk. The logic sounds responsible. The physiology is not. Martin missed one of his doses after a late afternoon appointment, realized the next morning, and decided to compensate. He was not being careless. He was trying to be precise. That is why this mistake is so common. It feels like discipline when in fact it introduces instability. What to do instead? If you miss a dose, follow the instructions that came with your medication or ask your pharmacist. In general, missed doses are not corrected by taking a double dose later. They are handled by returning to the normal schedule. Thing 3. Over-the-counter cold and flu medicines that contain decongestants. This is the one sitting in medicine cabinets everywhere. A person gets congested, has sinus pressure, cannot breathe properly through the nose, and buys a cold remedy without thinking of it as a blood pressure decision. But decongestants such as pseudoephedrine and phenylephrine work by narrowing blood vessels. That is exactly why they open the nose. It is also why they can raise blood pressure and interfere with the effectiveness of blood pressure medication. So now you have one medicine trying to lower cardiovascular strain and another over-the-counter product pushing in the opposite direction. That mismatch is especially easy to miss because the label says cold and flu, not may temporarily work against your blood pressure treatment. But that is often what it does. Martin developed a cold, bought a common decongestant, and never thought to check whether it mattered. By the time he noticed his home readings drifting upward, he blamed the stress of feeling unwell. The tablets in the cold packet did not even occur to him. What to do instead? If you take Amlodipine or Metoprolol and you need a cold remedy, check with a pharmacist before buying anything marketed for congestion, sinus pressure, or blocked nose. The question is not whether the product is over the counter. The question is whether it constricts blood vessels. Tell me in the comments right now, had you ever connected a blocked nose with a blood pressure reading? Most people have not. And thing 4 is even more ordinary because it usually enters the story not through illness, but through pain. Thing 4. Regular ibuprofen or naproxen for aches, joint pain, or back pain. This matters because the people most likely to be taking amlodipine or metoprolol are also the people most likely to have knee pain, back pain, arthritis, or recurring muscle aches. So the combination is common. NSAIDs, such as ibuprofen and naproxen, can increase blood pressure, promote fluid retention, and blunt the effect of many blood pressure medications. A person may be completely stable for months, then start taking a pain reliever more regularly, and gradually watch their readings climb without ever connecting the two. This is not usually one dramatic spike. It is often a quiet drift, and quiet drifts are dangerous because they are easy to rationalize. More salt this week, worse sleep, less walking, more stress, colder weather, anything except the over-the-counter pain tablets taken morning and night for 10 days. If amlodipine is in the picture, swelling may also become more noticeable. If metoprolol is in the picture, the person may assume the prescription has simply stopped working and needs to be increased, when the real issue is that another drug has been introduced into the system. Martin had knee pain after helping his son move furniture. He started taking ibuprofen regularly for several days. He did not think of it as adding a medication. He thought of it as getting through the week. What to do instead? If you need pain relief regularly and you are on blood pressure medication, do not assume the safest option is the one sold most casually. Ask your pharmacist or doctor what fits your situation, especially if you are needing pain relief for more than a day or two. Thing 5. Quietly stopping the medication because you feel fine or because a side effect scared or annoyed you. This is the one that connects the first 4. Some people stop because they feel better and conclude the medicine is no longer necessary. Some stop because they feel tired and blame metoprolol. Some stop because of ankle swelling and blame amlodipine. Some stopped because a home reading looked low one afternoon. Some stopped because they had dizziness after doubling up or after alcohol or dehydration, and decide the safest thing is to pause the medication until they settle down. This is the point where an ordinary side effect becomes a dangerous decision. With metoprolol, abrupt discontinuation can be especially risky. Beta blockers reduce the effect of adrenaline on the heart. When they are stopped suddenly, the cardiovascular system can rebound. Heart rate may rise, blood pressure may rise. In people with underlying heart disease, chest pain, or other serious problems can occur. This is why official guidance is so direct. Do not stop metoprolol suddenly without speaking to your doctor. With amlodipine, the issue is different but still important. If you stop it on your own, blood pressure control may worsen and the problem it was controlling can return. Official guidance also advises not to stop it unless a doctor tells you to. This is what happened to Martin. After the missed dose mistake, the cold medication, and several days of not feeling right, he decided to hold his tablets for a bit and let his body reset. He expected that decision to make things safer. Instead, his readings became more erratic, his symptoms worsened, and he ended up seeking urgent care because he no longer trusted what his body was doing. The pattern matters more than the specific symptom. Swelling, fatigue, dizziness, a low reading, a holiday schedule, running out of tablets, feeling better, feeling fed up. All of these become risky the moment they turn into a solo decision to stop. What to do instead? If a side effect is bothering you, if you think the medication no longer suits you, if your readings have changed, or if you have already stopped it, call your doctor's office or pharmacist and say exactly that. That conversation is what protects you. Silence does not. 5 things: grapefruit, doubling after a missed dose, over-the-counter decongestants, regular NSAID use, and quietly stopping the medication because the situation felt manageable at home. Notice what all 5 have in common. None of them feel like emergencies in the moment. They feel like breakfast, a correction, a cold remedy, a pain tablet, a practical decision. That is why people do them. And that is why these problems are so common. Amlodipine and metoprolol work best when the day around them is stable. The more casually other substances and decisions enter that routine, the more likely it is that side effects become confusing, readings become erratic, and the prescription gets blamed for a problem the prescription did not create by itself. One final detail. If you are having surgery, dental work, fasting, vomiting, diarrhea, or anything else that changes your normal routine, ask specifically how to handle your blood pressure medication on those days. Do not guess. Do not improvise. Temporary changes in eating, hydration, and timing are exactly when people make small medication decisions that turn into large problems. Which of these 5 was new to you? Tell me in the comments, and share this with someone who takes amlodipine or metoprolol and assumes that if something is sold without a prescription, eaten at breakfast, or skipped for only a day or two, it cannot possibly matter. It can. I am Dr. Clara Hoffman. 5 ordinary things, 2 common medications, and now you know what to avoid.